Hey guys, I'm back with part 2 of LASIK myths. So I'm Dr. Aparna Shah, board certified ophthalmologist and refractive surgeon. Jumping on the back of my previous video about LASIK myths, let's talk about a few more. So the next myth that I hear all the time is that you cannot have LASIK if you want to have kids. So my young female patients are always weary about it because they always heard this rumor. That is not true. If you want to have LASIK and then get pregnant that night, you can. That is totally acceptable. What is not acceptable is having LASIK performed while you are actively pregnant or actively breastfeeding. It is recommended that you wait at least 3 to 6 months after pregnancy, at least 3 months after you are done breastfeeding, because those hormonal changes can change the shape of your cornea and change your prescription. So you wanna make sure it all kind of goes back to normal after you're done, and then you can safely have this procedure done. The next myth, LASIK is just performed by pushing a button. Seriously? That is the furthest from the truth. It does matter what doctor or surgeon or practice you go with, because there is so much more complexity to performing LASIK than just pushing a button. And I'm not sure where that myth came from, but it is very, very delicate microsurgery. You need to make sure that you are doing your homework with your surgeon, make sure they know how to operate on the cornea, make sure they know how to deal with complications if they arise. You know, make sure you do your homework, because you are not just getting a procedure done where your doctor pushes a button. That is not true, okay? The next myth is that all lasers are created equal. It doesn't matter which laser I get. Also, not true. There are a few different excimer lasers, which is that second laser used in LASIK, and there are a few different femtosecond lasers, which is the first laser used. I've actually trained on every single femto and every single excimer, so I'm certified in all of them. And I can tell you that they are not all the same. There are some advantages and disadvantages to certain ones. Certain ones allow for certain technologies, whereas other ones don't. Again, do your homework, ask questions, make sure you're getting the latest and greatest technology, getting, you know, kind of the new innovative stuff, because LASIK lasers have been around for a while. So if you are getting operated on with a laser that's very, very old, you may not get the greatest results compared to a newer, more state-of-the-art, more technologically advanced laser. If you have any questions, please drop them down below.